we're tracking a surge of cases at Lowcountry hospitals. One announced a record high number of COVID patients. Another has zero ICU beds available. Our Caroline Betchun is working for you live outside of MUSC downtown tonight. Caroline, this situation very severe.
That's right, Dean. As of today, MUSC has run out of ICU beds, and Roper St. Francis reached a record high today, recording the highest number of COVID cases since the pandemic began. Roper St. Francis Healthcare is at full capacity. Officials say right now there are 157 COVID patients in its 4 hospitals.
We have the most COVID patients in our hospital than we've ever had since the start of the pandemic. 1 out of 3 beds is now occupied by a COVID patient.
MUSC also dealing with the surge. There's currently 135 COVID patients hospitalized at MUSC. 26 of those are in the ICU. Officials say they're trying to make room, now putting ICU patients in the emergency department, PACU, and other hospital floors. The COVID surge has taken a toll on frontline workers.
They're fighting hard, but they're tired and they're weary. This is 18 months that they've been at it. This is our 3rd surge of COVID, and they are having to dig deep to find the strength to get through this.
According to the New York Times, South Carolina has the highest rate of COVID cases per capita in the United States.
I want you to be amongst the 50% that are vaccinated, but that is a horrible number, particularly when you have something that works so well and that the consequences of getting it are so horrible.
Both Roper and MUSC say 80% of its current COVID patients are unvaccinated.
There is a really good reason to get the vaccine. It will save your life.
It's unclear how long this 3rd wave of COVID will last. Doctors tell me they do not see the light at the tunnel just yet. The only option right now is to vaccinate and mask up.
A heated in-person meeting resulting in an all-virtual move.
All opposed to option B?
A decision so controversial in the room, the one no vote on the board, Barbara Crosby, walked out of the door before the meeting even ended.
Thank you, Barbara. Thank you.
In the end, September 7th to September 15th will be the dates for virtual learning, a decision that came after hours of discussion and statistics. Multiple parents were upset about the lack of ability for them to speak at the meeting.
They're just making decisions, but they're not listening to what we have to say. They say that they're listening, right? They say they're hearing, taking emails and all that. But are they listening if they won't allow a few of us to just stand up and voice our concerns to them?
Board members say they legally weren't allowed to add a public comment section and made this decision for the safety of staff and students.
But the most important thing is, and what we are tasked to do, is to make sure we provide the very best education we can for our students while they're safe.
Board members say they had just as much vocal support from parents for virtual learning as they did against. In the end, they say the situation demanded action.
We have office personnel going in to teach those classes at this point because we've got students in those classes that don't have a teacher. And we don't have the substitute pool. Nobody will come in and to take a chance on their own health to come in and substitute for us. So this delay in time will allow us to get those teachers back.
But for the parents here, this is time they can't afford.
Well, I got to work, I got a job, so who's going to be home watching him, making sure he's doing the work he's supposed to? I'm not excited about the way this went tonight.
Now, other situations affected by this virtual learning will be athletics, which are suspended while the school district is virtual. Another thing that the staff mentioned is that they will be monitoring a potential legal decision from Columbia on whether or not school districts can enforce masks.
All right, Dave, thank you very much. Well, flooding relief may be in sight for residents in West Ashley. Now, these are neighborhoods along Douglas Avenue near Savannah Highway and I-526 inundated with water. And we've been working for you to get answers from officials. And tonight, our Ann Emerson finds out what's being done to help.
We're here in West Ashley where they've had a problem with flooding in certain neighborhoods. Now what they're doing is clearing out these drainage pipes. They've been filled with sediment, which has blocked them. If they can clear them out, it should create better drainage for a retention pond just on the other side. These are Charleston County work crews knee deep in the dirt and gunk, clogging pipes just off of Dunbar Street.
Phase one is what we're doing right now, which is doing some maintenance work on some pipes and ditches.
One of 4 phases the county and city are working toward to mitigate water flooding streets.
The goal is that it helps the intersection of Piper and Cessna, which floods quite a bit, by creating more storage in that area and allowing for an outfall from that pond.
This is what the Air Harbor neighborhood looked like back in July. In the end, officials will redirect the excess water to the marsh, but that's long term, 3 to 5 years away. Clearing these pipes will mean water should drain more efficiently now.
There's a drainage pond on Cessna Drive that we're trying to get to drain better so there's more storage in the Air Harbor neighborhood.
Dirty work that could end up saving neighborhoods and homes.
I just want to thank our maintenance guys. They work day in, day out, cutting line, cleaning ditches, cleaning pipes. They're the guys who really make this work happen.